non-skilled personnel and would no longer meet criteria for continued coverage. Colostomies, ileostomies certainly can be necessary to teach individuals what the necessary processes are to manage these or teach family members, but after a period of time, then it can transition to non-skilled service. Dressing changes, again, depending on the wounds, the situation, they may or may not be a skilled level of service. People on routine inhalation therapy, even some ventilator patients can get to the point where they've exhausted their 100 days and they will then go to a custodial level of care. They'll be in facilities where they can get that care. Just a couple of other things I want to talk about. Dr. Parker mentioned the NaviHealth. NaviHealth is a organization that's collected data over the last 12 years regarding outcomes of post-acute care. And they've then developed algorithms that allow us to go ahead and predict what levels of care people may need based on certain parameters, what is the best place for that level of care to be given, and what the time frame would be for certain outcomes to be achieved. And so we have partnered with them, and they've brought that expertise to us. And I would encourage you to work with them when they're in your facilities, to use them as a resource to help in discharge planning and looking at opportunities. They have social workers involved there. They have case managers and coaches that will go out and work with the families. They'll work with the PCP's office to go ahead and try and integrate interventions to try and reduce those readmissions and make sure that your patients and our members get the best level of care that they can get. So they're not there to make things difficult for people in the hospital setting. They're really there to try and integrate and look at opportunities to provide a level of service that the patients need. And as we go forward with more and more people in this Medicare population and the cost to deliver their care, we have to look at different paradigms on how to deliver that. I think back to when I first started in practice, and I went to a small town in Iowa, and they were complaining about the managed care companies not allowing them to admit somebody with back pain to the hospital for a week. We would never admit patients now for a week for their routine back pain problems. And so we've changed our thought process and how we manage things. And I think with this population, we need to go ahead and going forward, look at different opportunities to go ahead and provide the level of care they need, but maybe not in the same sort of settings that we provided those in the past. We may need to look at what can we provide as resources in the community, or through home health, or through therapy services in the home or in another setting where we're going to be able to achieve the same outcomes, which is one of the things that they've been able to do with the predictive modeling they have at NaviHealth. Produce the same outcomes, or actually better outcomes in some cases, with that intermittent level of therapy than the old idea of just sending everybody to the nursing home for a couple of months until they get better. The other thing that you may also see in the news is a recent settlement against Medicare for how they covered skilled level of care. There was always